Thanks as always to our partner, Fortified Health Security. No matter where you're at in your cybersecurity journey, Fortified can help you improve your cybersecurity posture through their 24/7 threat defense services or advisory services delivered through Central Command, a first of its kind platform that simplifies cybersecurity management and provides the visibility you need to mature your program. Learn more at fortifiedhealthsecurity.com. Hi, I'm Drex DeFord, a recovering CIO from several large health systems and a longtime cyber advisor and strategist for some of the world's most innovative security companies. And now I'm president of This Week Health's 229 Cyber and Risk community, and this is UnHack the podcast, a mostly plain English, mostly non-technical show about cybersecurity and risk and the people and process and technology making healthcare more secure. And now this episode of UnHack the podcast. Hey everyone, welcome to UnHack the Podcast. I'm your host, Drex DeFord, and today we're going to talk more about the completely free and incredibly useful stuff that's produced by the Health Sector Coordinating Council's Cybersecurity Working Group. As I've said before, it's from the government. There's a lot of acronyms. We'll shorten that today to CWG for reference. So the Health Sector Coordinating Council Cybersecurity Working Group, or CWG, is composed of 400 plus industry and government organizations that work together to develop strategies to address cybersecurity challenges in the health sector. And one of the many things CWG does is through a task group process, they develop these free resources focused on sound cybersecurity practices for a range of healthcare cybersecurity disciplines. And today we're going to talk about a set of those resources. And this set is focused on responding and recovering from incidents. And I'm lucky enough to have a guest today who knows way more about this than I do. Hi, Lisa. Thanks for being on the show.
Hey, Drex. Thanks so much for having me.
Of course. We're going to talk about some of the work that you've done helping to create some of these really great free resources. But first, introduce yourself and tell me about your role at St. Luke's. And you have a really interesting job and reporting structure and a path into that job. So tell me a little bit about yourself and give me some of the backstory.
Yeah, I'd be happy to. So I work for St. Luke's Health System. I manage their cyber resiliency program and report directly to our CISO. But really how I got into cyber is a mystery. My background really is in public health, and I thought I was going to do health promotion. And right out of my master's program, I took a job at the public health district doing emergency management and public health preparedness. From there, I just really fell in love with healthcare delivery and our hospital systems. So I transitioned to be the emergency manager for the St. Luke's Health System out of Boise, Idaho. I was in that role for about 5 years. And at that point, we really saw cybersecurity picking up in the healthcare sector and these attacks becoming not only more frequent, but also a lot more impactful.
Mm-hmm.
At that point, St. Luke's developed a new program that was called cyber resiliency. And so I fell into my new role within St. Luke's. I've been in that role for about 4 years. And it's been so rewarding to take my background in public health and my passion for not only the health of our community, but the health of our patients, and be able to take the skill set I learned in emergency management and apply it in this new, exciting, fast-paced cybersecurity environment. Constantly learning all these new things, whether it's our current threat landscape or different vulnerabilities, but then being able to apply that, to how impactful it could be on our operations has been really helpful, and really something that has been a fun and exciting kind of twist and turn in my career.
I love that. So you've got like the peanut butter in my chocolate career thing going on. And it's cool when it just all works out and you can figure it out. The big thing about that I think that is unique and special, and to me really interesting that you bring to the table, is the public health angle on this, because there's more and more. We'll get to this stuff that we do for CWG, but the really interesting angle of when there's a cyber incident with a health system in a community, it really affects way more than just that health system. That whole community can be turned upside down, right?
Absolutely. And I think it's A lot of times we hear of these big health systems, but in reality, all of healthcare is so vulnerable. So whether it's a public health department, a single provider office, all the way up to the large scale health system. And so, like you talked about, we'll talk about it a little bit later, but the sector coordinating council really looks to ensure that we're providing support for that entire realm of healthcare, knowing that healthcare as a whole is really vulnerable these days to
Yeah.
cybersecurity activity.
Yeah. And so, yeah, now let's bridge into that. At some point, you became involved in the CWG, the Health Sector Coordinating Council Cyber Working Group. How'd that happen?
I had just come into my new role and was looking at ways to learn more about this new cyber world. And they were just kicking off a brand new work group that was incident response business continuity. And it seemed like a really good fit. And I felt really fortunate because I came in right at the right time. So this was about 4 years ago.
Mhm.
And so far, it's just been such a treasure to get to be part of this amazing work group with not only great stakeholders, but also just really great resources that we've been able to develop. So on a whim, but perfect timing to be able to jump into a brand new work group that really fit with what I'm doing.
Yeah, timing is everything. I will say that over and over again. So like one of the you're really early into CWG. I'm like maybe a year and a half in as a member, but you were there and you had things produced before I ever showed up. You're the leader, or you're one of the leaders. I'm not sure exactly how to say this because I know it's all a team effort on the coordinated healthcare incident response plan with the acronym CHIRP, and the operational continuity cyber incident document, the OCCI document. And then there's an executive checklist coming soon. You and a lot of folks put a lot of time and effort, volunteer effort into this work. Why did HSCC CWG feel like this was such an important topic for them to produce material on?
The reality is, like I've said, we're all vulnerable, but the skill set and the amount of time and effort that each healthcare entity has to give to cybersecurity preparedness and awareness is different. However, I feel like it's something simple that we can provide from a council perspective. And we really were discussing as a work group, what could a product be, or how could we ensure that the time and effort that we're providing here is as productive as possible for our members as a whole. We identified that simple, easy to use, out of the box products would be so valuable, not only for maybe a large health system that was impacted, but maybe that critical access hospital that has two IT people as a whole.
Mm-hmm.
Healthcare is ever changing and moving quickly. So, how can we create tools that are not only educational, but could be operational relatively quickly, or like I said, out of the box, to be able to help them be more resilient in the time of a cybersecurity incident?
It's scalable across that whole range of health systems, right? It's hospitals, health systems. Let's talk about the documents. If you can walk me through and just hit me with some of the highlights. Do you want to start with CHIRP, or you want to start with OCCI? Is one a logical predecessor to the other?
We started with OCCI. Some people call it OCCI, some people call it OCCI, but really that was helping to, the purpose of that document is really to help bridge IT and emergency management and cybersecurity. I think, as I'm sure you, Drex, a lot of times we work in our separate silos, we're all working on things. But we're really fortunate in the group to have some members that have been through a cybersecurity incident. So we
Mm-hmm.
leveraged a lot of their best practices. And one of them was, how do we get everyone at the same table so that we're working towards the same objectives? We have the same understanding. And so the uniqueness with OCCI is we partnered really closely in leveraging my emergency management background, as well as some of the emergency managers we have as part of the council, to develop a product that mirrors the hospital incident command system.
Right.
So this document is really built more for the hospital side of it and really built in a way that can be easily operationalized given processes that unfortunately due to COVID, they got really used to using incident command. So
Yep.
we took those same fundamentals, but applied them in a checklist format that could be initiated in the first 4 hours of a cybersecurity event as
I,
well.
I like the thing that you've done here is that you've decided to build this in a way where you're speaking the language, not of the security team or not of the IT team, but you've built a checklist that speaks the language of the people who do this work all the time. It's
Yeah,
really
it's
cool.
critical, right? I think we take for granted sometimes. And just the same, healthcare can turn it on us in IT, and sometimes we don't understand what they're saying. So that communication piece is so important. Another big part of OCCI is having a seat at the table for your cyber or your IT individuals and making sure that they can be collaborative in some of that. The document we developed is great out the box. So heaven forbid something's going on, you can pull it up. But obviously, best put together prior to and tailored to your needs would be the best there. But really, a great tool for any part of healthcare and aligns with some of those key initiatives they're used to using already.
Yeah, I like that it really is an out of the box thing. If you've never done it before, it gives you a great jump start. You can sit down, you can literally fill out names and create the document that you want to use, hopefully for the tabletop exercises and the other things that you do as you prepare for, and never happens, the cybersecurity event. But sometimes it does happen, right? Let's talk
Great
about
point.
CHIRP, maybe. Sorry.
Yeah. No, you're good. CHIRP is flipping a little bit. So while OCCI was really developed to help our hospital teams and partner through emergency management, CHIRP is a high level template focused on incident response planning. As we're aware, depending on the size and scope of your facility, you might have a robust cybersecurity team. And so this tool really was meant to be more focused to IT and cyber, but be able to identify some of those things you might not have considered, some of those retainers you might not have, or those
Mm.
partnerships you might want to think about, or if something happens, who you should be reaching out to from a more technical perspective early on within your incident. Again, great template, but this one for sure is helpful to vocalize with your and cybersecurity teams prior to and be able to start doing some of that work. But again, a really great template and a really great opportunity, even for a mental checklist of what are those things that we need to think about, or what are those things that we might need to have in place. It acts like an amazing foundation to start building a really solid cybersecurity incident response and recovery plan.
Even things like, as I went through it again, the reminder of who has the authority to say that we can disconnect from the internet
Yeah.
should something go on, or, and there's a place for that. These are all things that I think we think about sometimes when we talk about it or we go through exercise. You actually have it written down in the plan. These are all these, it's not an exhaustive list necessarily, because that's almost impossible, but you all really did a great job of putting together a lot of those. It's almost like a workflow template. All the stakeholders, who has decision authority, all that kind of stuff is there for them to use to build the plan that is theirs.
Thanks, Drex. That
Yeah.
that means a lot. I think our group is really thoughtful in what we put together. We know everyone's really busy, and so you have to walk that fine balance of making sure that it's long enough to have the information you need, but also be formatted in a way that's operational moment in time. So I'm really glad that was the takeaway you had
Yeah.
from reviewing
No,
it.
I love it. What haven't I asked you about this that I probably should have asked as we roll down toward the end of the program?
Ooh, that's a really good question. I think one of the things that we don't share enough from our work group is while we develop products, I will say that one of the really great things that I've gotten from being part of the work group is the ability to network, the ability to build partnerships, to be able to have colleagues that you can leverage best practices from all across the country. So while the products are fantastic, would really recommend getting involved, whether it's I think we're getting ready to push out a new strategic plan with a new set of work groups. So really recommend individuals that might not have too much time to commit, but need to have a really solid network, looking into the Health Sector Coordinating Council and the Cybersecurity Working Group, really to see the opportunity to dovetail in. I'm pretty engaged as a chair of one of those work groups, but there's all different levels of participation and engagement that can match the time commitment that you're able to give. That might be something that we haven't talked about, not just only the tools that you can get from the cyber working group, but also just this amazing opportunity to meet others and learn from others across the country.
I 100% agree. I think the opportunity to be able to meet other people and learn from other people and have them in your speed dial when something goes perfectly well and right, or hey, here's an idea that I have. You have other people you can reach out to and bounce those ideas off of, or if you have a problem, obviously, folks you can reach out to. There's one other thing I wanted to ask you about now that I think about it, the executive checklist, which is coming soon. What's that going to look like?
Yeah, this is an exciting new product that we're putting out soon. The executive checklist, again, looking at a different audience this time. While a lot of our products have been healthcare wide, this one really is scoped more towards the hospital audience and really towards our executive response or our executive team at those different hospitals. Really, the core of the document is about helping healthcare executives to understand their role in an incident response. It really prioritizes cybersecurity threats that can cause significant disruptions. And it really goes all the way from thinking about blood donations that could be destroyed due to an incident to surgeries that might need to be postponed, with really the kind of the foundational element there from an executive level. What are those things that you need to think about in order to continue your operations? It's written more in an executive summary type fashion, with focus areas on incident response and business continuity, additionally communications. So just different high level pieces that are not only important for our cybersecurity event, but also written at that level for executive decision making and an awareness as well.
Got it. And all this available completely free. You can get it on the Health Sector Council. It's healthsectorcouncil.org website. There's a library, tons of stuff up there. And in particular, when we run this show, we'll make sure we put the link in the show that specifically connects to the stuff you've been working on. Hey, thanks for being part of the show today.
Yeah, thanks for having me. It was so great to see you again.
Good to see you too. That's a wrap for this episode of UnHack the Podcast. Do me a favor and share this episode with your peers. And by the way, your feedback matters, so please subscribe and rate and leave a review wherever you listen to podcasts. I'm your host, Drex DeFord. Thanks for spending some time with me today. And that's it for UnHack the Podcast. As always, stay a little paranoid. I'll see you around campus.